You know, it's incredible how many women might feel a pang of anxiety when they hear, "You have an ovarian cyst, right?" But the truth is, not all cysts are the bad guys here. In fact, the majority are completely harmless and just kind of hang out for a bit, then resolve on their own. Let's dive into this. Today, we're going to explore the symptoms, causes, types, and treatment options, all laid out in a way that's, straightforward and accessible. It's almost like peeling back the layers of an onion, but not quite as tear-inducing.
Okay. So, I've never really thought about cysts before, but it sounds like there's a lot more to it than just cyst being a scary word. Are they like little bubbles?
Exactly. So think of ovarian cysts as little fluid-filled sacs that form on or in the ovary. Most of them are about as harmless as a peaceful bubble bath, just chilling until it's time to pop.
So are these bubbles in a bath just kind of floating along and then poof, gone? Because what happens? Do they leave a mess behind or something?
Haha, not quite a mess. Most of the time, these bubbles, cysts, just resolve on their own. I mean, over 70% of women will develop an ovarian cyst at some point in their lives. It's like an unexpected guest that overstays its welcome, but, eventually takes the hint and leaves. But there are still some situations where they need a little more attention.
Wow, that's a lot. So how would someone even know they had one? Is it they just feel it or something?
Great question. The common symptoms to watch for would include pelvic or lower abdominal pain, cramping that doesn't feel normal. There's also bloating or a feeling of heaviness, irregular menstrual cycles, and sadly, some nausea or pain during intercourse. But here's the kicker. Some cysts are silent ninjas. They show no symptoms at all, which is why ultrasounds are so crucial.
Silent ninjas? That's wild. It's like they're stealthy little assassins, just lurking in the shadows. So, how do you know when it's time to go to the doctor or not?
Haha, exactly. You definitely want to keep an eye on those ninjas. You'd want to visit a doctor if you experience sudden severe abdominal pain, dizziness, or fainting. It's like those are your warning sirens, or if you've got a rapidly growing cyst that just won't go away after months. That's the moment when you want your pulse racing in a healthy way, right?
Right. Ooh, okay. And then there are different types of cysts, right? I remember you mentioning that earlier.
Absolutely. So we have functional cysts, which usually disappear without much fuss, like the casual surfer that catches a wave and then heads back out. Then we've got endometriomas, linked to endometriosis, polycystic ovary syndrome, or PCOS, which is a whole other ballgame. There are also dermoid cysts that can contain a little bit of hair or fat, and cystadenomas, which grow on the surface of the ovary.
Wait a second, is that like some kind of science fiction movie? Like a cyst that has hair? What would that even look like?
Haha, a little surreal, right? Imagine someone knitting a little hat for their cyst. It's bizarre but true. It's just a quirk of how some of these cysts can form. And they might sound strange, but most of these cysts are not dangerous, which is the silver lining in this tale of fluid-filled clouds.
Okay, so if someone has a cyst and it's not doing anything scary, what's the follow-up? Do you just sit on it and wait?
Well, that can be part of the plan. Sometimes it's just about watchful waiting, allowing the body time to naturally resolve small cysts. For others, hormonal medications like birth control pills can really help prevent new cysts from popping up, like setting a guard at the entrance. And in cases where the cyst is bigger or could cause trouble, surgery might be the way to go.
Whoa, a guard? Sounds like a whole fortress. And what about when it's all crazy? When should someone just drop everything and run to the doctor?
Right. Those warning signs I mentioned earlier are super important. Like, sudden severe abdominal pain is sort of the red flag you can't ignore. If you're feeling dizzy or faint, or if that cyst is behaving like it wants to grow bigger and badder, those are moments where you need immediate medical attention.
So it's all about listening to your body, which is like, wow, should we be sharing this info with friends if they're potentially having issues?
Absolutely. Knowledge is power, and sharing this kind of information can empower women to advocate for their health. Not all ovarian cysts are dangerous, but understanding what you're dealing with is key. Have you ever come across anyone dealing with something similar? How did they handle it?
Oh yeah. I had a friend who mentioned something about irregular cycles, but she never really touched on cysts. So I wonder if she just assumed that it was another day in the life of her body.
That could very well be. It's wild how many women might experience symptoms but don't connect the dots. That's why conversations like this are so important, opening doors to understanding and empowerment. If anyone learns something that could make a difference, that's a win.
Totally. I'm excited to learn more about how to help others.